inferior point of view of the skull. Okay, we're going to look at all the major bone markings and foramen that are in the skull. So if we kind of start from the top and work our way down, okay, we can kind of see this area here. This area here is considered what? The frontal bone. And we have this little area here, which is considered the ethmoid bone. Okay, the only part of the ethmoid bone that we're really seeing is the crista galli, which is this little point right there, which is where the dura mater attaches to, the outer covering of the brain. And if we look really closely, we have these little perforations called the we say cribriform, but no, cribriform foramen, and those basically are going to allow for cranial nerve number 1 to pass through, right? Cranial nerve number 1 is the olfactory nerve, and that deals with the sense of smell, right? So that's an important landmark right there, because that's the first cranial nerve already, right? And the ethmoid bone and the cribriform plates, right? If we kind of move down, we can kind of see this next bone. So posterior to the frontal bone, right, is going to be this bone here, which spans the width of the skull, and this is the sphenoid bone, right? This sphenoid bone. Here we have the lesser wings, right, and here we have the greater wings, right? So all this is considered the sphenoid bone, right? If we turn it over to the inferior point of view, we can also see the sphenoid bone here. If we trace it out, you can kind of see the line, right, where the sphenoid and temporal bone meet, and this is the occipital bone that we're seeing here, right? Can you see those markings right there? So it's important that we understand where we're at. That's the vomer that's there, right? The vomer. So I understand my anatomy, right, of the skull. If we turn this guy over again, the first kind of opening that we're seeing, if we kind of obliquely point to this area here, are these little perfect little circles, these little perforations, these little foramen. Those are called the optical foramen, right? Or sorry, optic canal. Optic foramen, optical canal, same thing. You can see it exit there, okay? And that's going to be a passageway for the optic nerve to pass through. That's cranial nerve number 2. That's for vision, right? Okay. If we go, and then we have 2 of them, obviously. And if we go a little bit lower than that, we see like this kind of obtuse, open-ended like fissure. And if we turn it over this way, you can kind of see the fissure here, right? So this is going to be the superior orbital fissure. Okay. Sometimes they call it SOF, right? Superior orbital fissure. And the significance of that is 3 cranial nerves are going to exit this, which all dictate eyeball movement. So those are cranial nerves number 3, 4, and 6. Okay. 3, 4, and 6. Okay. We also have the body here. You know, the body has the sella turcica, right? And this is where the pituitary gland would sit, right? On the sphenoid bone, right? So inferior to that fissure that we were just looking at is a perfectly round foramen. That's called the Foramen Rotundum, right? If we go immediately lower to that, we have the Foramen Ovale, looks like a little oval, and then inferior to that we have the spinosum. Okay, so we got 3 little openings, 1, 2, and 3. And the significance about the Foramen Rotundum and the Ovale is that cranial nerve number 5 passed through there, and that's the trigeminal nerve. That's the one that basically deals with chewing, mastication. So you guys see those openings? That one there is the Ovale, and this one here is the Rotundum. Let's see if that one kind of goes. So you guys see where the Rotundum kind of is going out. It's like where you're right there.
Oh, okay,
right?
Gotcha.
So the most common point of confusion is this. Students will think this is the Ovale. You guys see this one here? This one, if you look at it, it's like lateral, immediately lateral to the body of the sphenoid. You guys see that? This right here is what? This is the foramen lacerum. Lacerum. You guys see it on the bottom side? Lacerum. So it's the union between what 2 bones? Between the temporal bone and the sphenoid bone. It's that and that. Okay? So don't confuse these structures with those structures, right? This is the ovale. That's the spine. That's the ovale. This right here is the lacerum. Okay? So we want to understand that. So all those are the major markings of the sphenoid bone. So now we can go on to the next bone, okay? The next major bone here is going to be the temporal bone. So if we kind of continue down, we're going to look at the internal acoustic meatus. Do you guys see that opening here? And then there's another opening here. I think it's number 71 there. Can you see that one? I don't know if you can see it. Right here.
Okay.
Okay. That one there, and that one there. So if you look at this whole area here, this area here is continuous with this here. You see your external acoustic meatus? So it looks like your inner ear, the housing of all the components of your inner ear would be here, right? So that's where it is. So this is the internal acoustic meatus, and two cranial nerves are going to exit through here, which is your facial nerve and your vestibulocochlear nerve. And facial nerve is going to give innervation to all the facial muscles that you have here to move your face. And the vestibulocochlear nerve is, as you see where it's located, it's basically hearing and balance, right? So that's an important structure to keep in mind too. And that's going to be on the temporal bone, right? Does that make sense why it's temporal? Because it's in line with the external acoustic meatus. That's temporal. And also the internal acoustic meatus, right?
Okay.
Make sense? That's the new one that I think we talked about the other day, all right? So kind of continuing down, we have another large opening here, right? If you look at that one, it's a very big opening on either side. So if we put it through here, you can kind of see this opening here. That's going to be the jugular foramen, right? And the significance of the jugular foramen is that cranial nerves 9, 10, and 11 pass through here, okay? 9, 10, 11 cranial nerves pass through there. And it's also on the temporal bone, correct? Right, it's temporal bone. And then there's another little opening that's superior to that, best viewed on an inferior view. The opening's too small. I don't know if you can really see from this point of view. It's kind of hidden. You can't really tell from the superior, but on the inferior you can tell, right? So it's this one right here, that one right there. That's the carotid canal, right? So the carotid artery passes through there, right? The internal carotid pass right through those little foramen. Then you also have, if we kind of follow along between the mastoid and styloid process, right, which are also on the temporal bone. You have that little opening right there. Do you see that one? Right between there? So it's between the mastoid and styloids. It's called a stylo mastoid foramen. Okay, and one of the branches of our facial nerve passes through there as well, if you want to get technical. And the last opening that we have here for cranial nerve number 12, if you notice, this is on the occipital bone. It's the only foramen that's on the occipital bone for a cranial nerve. It's this one right here. It's kind of hidden. Do you see that one right there? That one right there. That's going to be the glossopharyngeal nerve. So the glossopharyngeal nerve deals with tongue movement, okay? To move the tongue. So that's cranial nerve number 12. It's going to be on the occipital bone. So those are the 12, at least we went through 12 major foramen. I think a little bit more than that, but those are the 12 major ones and their associated cranial nerves. So those are really important that we understand. That way we have context. We understand what the holes are for, right, now, and we understand what structures, what bones relate to them, the names of the openings, and what structures pass through them. So that's important that you guys understand that. And if you guys notice, I went through both sides, right? I kept flipping it over, so we understand both sides of either one, okay? So review those are the major openings. If we review the other major structures here of the skull just in general, we have the frontal bone up here. This would be the glabella, right? We can see the supraorbital notch right there, right? The little notch above the eye, okay? What was that one called again? The infraorbital foramen, I think, right? The infraorbital foramen is below the orbit of the eye, right? If we look at the temporal bone, the other structures to keep in mind, we already talked about the external acoustic meatus, styloid, mastoid process. I'm trying to think of, the occipital bone, you've got the condyles, right? Those are the occipital condyles, right? Occipital condyles. Also on the occipital condyles, you've got these ridges here called the nuchal lines, right? Nuchal ridges, nuchal lines that you're seeing there for attachment of all those neck muscles back here. I think those are all the major markings of the skull that I think are highlighted, of the cranium to really know. Okay? All right, cool.